And of course, I want to thank Sasha for the warm welcome today. We are in a very unique time in history where it is virtually impossible, if you are a living, breathing adult, to ignore how race, economic disinvestment, and environmental injustice has impacted every facet of our lives, particularly now with COVID-19. You know, if you can't help but look on the news and hear how COVID-19 deaths are now over 150,000 here in the United States. And we have to be even more focused on how Black trauma and racism has impacted the high rates of death related to COVID-19 for Black people particularly. So I wanted to just set the discussion and the intent around really thinking holistically about the intersectionality of all of these issues and then how we're seeing it play out. And also just calling to attention that we thankfully are very fortunate that we have members of Congress and the Senate who understand these intersectionalities. Just this morning, Senator Kamala Harris, Tammy Duckworth, and Senator Cory Booker will be introducing a companion bill to the Environmental Justice for All Act, which both Black Millennials for Flint and We Act, a number of other organizations played a very integral role in vetting and making recommendations to. The Environmental Justice for All bill was first introduced earlier this year on the House side by Congressman Donald McEachin of Virginia and Chairman Raul Grijalva of Arizona. And so the Senate and the House companion bill acknowledge how factors such as segregation, racist zoning codes have rendered communities of color more vulnerable to the effects of climate change and has left us with limited resources to address ongoing environmental health disparities. So I really behoove folks, you know, beyond this conversation to take a look at both the House and the Senate companion bills and reach out to your electeds if they haven't already signed on or co-sponsored. But we want to make sure that as we really hone in on what's going on in our country, that we have legislation in place that will protect our most vulnerable. So wanted to begin this conversation and just kind of set things there in that context. But let's move on. I wanted to make sure that we introduce three key terms here before getting into this conversation. Comorbidity, and this is the presence of one or more additional conditions, often co-occurring with primary conditions. The term body burden refers to the total amounts of these chemicals that are present in the human body at a given point at any time. And also another term, adverse childhood experiences, which are traumatic events that occur to many of us before we turn 18. And what is and this is the question to, and before we get into that question, let me also allow the other panelists to introduce themselves. So I apologize, I'm gonna go backwards. Can we also have our panelists introduce themselves?
Hello, everyone. My name is Jasmine Tasaki. I am the founder and executive director of WeCare Tennessee in Memphis, Tennessee. My pronouns are she and hers, and I am just honored to be here today and am ready to have some vigorous conversation around environmental justice.
Hello, I'm Jasmine Hall. I'm a Flint, Michigan native, born and raised. I'm also a lead prevention ambassador with Black Millennials for Flint. I recently moved back home after studying epidemiology, psychiatric epidemiology specifically, and I am really excited to be here.
And hello, everyone. I'm Daniel Dawes. I am the director of the Satcher Health Leadership Institute at Morehouse School of Medicine, where we are leading the creation and advancement of racial health equity. So I too am very pleased to be here and talk about issues dealing with political determinants of health to social determinants of health.
Thank you very much. And so we look forward to this great conversation. So I'll reintroduce those words again: comorbidity, body burden, and adverse childhood experiences. And so to all three of the panelists that we have here, if you could, what are some examples of environmental racism that either you or someone you've loved have experienced and that have caused either or both childhood or adult trauma?
And I'm sorry, Kerene, if I could add, this is Sasha. If folks could please share their pronouns, that would be great. Thank you.
My pronouns are she, her, her. Sorry about that.
And he and him.
And I said mine, but I'll say it again, she and her.
I'm happy to kick it off, being from Flint, Michigan.
Sure.
This might be the epitome of environmental racism, looking at the Flint water crisis. And while I was away in college during most of the water crisis, of course, my family members were in the city of Flint. My siblings are all millennials, so their children were under the age of 5 when the water crisis started. And this is obviously going to it's impacting their childhoods now. And we see several children, several adults who are experiencing serious impacts from the water crisis, and we don't even know what will happen next. But fortunately, we do have resources and programs and community building that is we're trying to do everything we can to make sure that active environmental racism and injustice, we can at least mitigate some of that impact.
And if I could add, when we talk about environmental racism, I think it's just as insidious and harmful as any other form of racism. And I think that's just plain and simple. Mm-hmm. And I talked about the social determinants of health, right? Which all too often housing and living arrangements play an outsized role in access to care and quality of health resources that are available. And we know that this reality can be exacerbated by environmental racism, as it has a more direct link to these social determinants. And so from a personal level, I'm from South Florida, so I have a constant reminder of environmental racism every time that I venture down the highway. As we see climate change beginning to truly wreak havoc on the coastlines of South Florida and other parts of Florida, from the Atlantic to the Gulf Coast, we're continuing to see environmental racism come into play as the demographic and real estate trends shift from the coastline to areas that are further inland and at higher altitudes. So you just need to look at Little Haiti in South Florida, for instance, right? And Liberty City down in South Florida, where my family live. And it's interesting to see how there now is this climate gentrification that's going on. These metropolitan areas, they are grappling with gentrification based on the availability of profitable land. And South Florida is certainly dealing with this tenfold as climate change has sped up that timeline.
I think for me, the closest personal entity that I've had would be Katrina. There were a lot of friends and family that moved in different places during Katrina, and I had some friends that lived there, but I made new friends that moved to Memphis, and I just see how some of them had children, some of them didn't, but I can see how as adults, it's changed how they even how they look for jobs, how they look for homes, how they raise their children. That experience has ultimately shaped who they are as adults. And some of them went through it as adults, right? So I know that their children, I don't know, I'm sorry, but I know that it will be not good for the children because their parents have had to reintroduce themselves to themselves as they moved out into other areas. So, yeah, that's the most personal, Katrina.
Thank you for that. Now, this question is specifically for Dr. Dawes. In your book, The Political Determinants of Health, which was just released a couple of months ago, you talk a lot about how these realities are affecting Americans, whether it's worsening health outcomes, health inequities, or declining healthcare options. Can you let us know more about what the political determinants of health are, and then why that is important for doctors and scientists and others that are public health providers? Why is it important for them to think about that framework that you've presented?
Sure. Well, thank you so much for that question. I guess what I'll do is bring this image into our minds. If we were to envision all of society sitting on the banks of a mighty river, fishing and finding nourishment in the resources that the river provides, the health inequities that we face are represented by the differences in the caliber and the quantity of fish we encounter. So some people have a bounty of healthy fish and vegetation to feed off of, while others may only have small fish, no vegetation, or malnourished fish, right? And I think different people having access to different types of resources and different parts of the river represent the social determinants of health. Some people are located in a slower moving part of the river by no fault of their own. Others are located in more lush parts of the river and benefit because of such, by specific decisions that were made on their behalf. These are the political determinants of health. So somewhere upstream, decisions were made to divert the river to benefit certain people and harm others. And decisions were made to place certain types of people on specific banks of the river while placing others elsewhere. So these upstream decisions have downstream impacts, and we must be involved in that decision-making process.
Thank you for that. I wanted to add Jasmine to this conversation as an epidemiologist, as someone who does the research on this. How do you view these political and social determinants of health in your work? How do you look at that?
Yeah, so I just want to really echo what Dr. Dawes is saying, because we see, we can analyze data all day and, see, okay, is this associated with this? Did this maybe cause this? But really, if we're not talking about the actual decisions that were made, the policies that were changed or not changed, then we really aren't going to eliminate health disparities. So like you're saying, like we absolutely have to think about these upstream decisions. I think about the Flint water crisis and the emergency manager rule. I see you nodding your head, because this, took away power from residents in our community. That voice, if people were really at the table, perhaps it wouldn't have been 18 months where my community was being poisoned and had no control.
Thank you.
And can I actually add on top of that too? Is that okay?
Definitely.
Okay? So Jasmine got me really excited, because as we think about this, even the issue of air pollution, right? That's a political determinant of health. So when you go into Black communities all across the United States, whether it's in Overtown in Miami, you go to Atlanta, to Baltimore, New York, Boston, Detroit, St. Paul, wherever you are, Omaha, Nebraska even. In many of the Black communities, there is a highway that cuts right through the middle of these communities. Mm-hmm. Or we may see bus depots that have been located that abut these communities, right? And it's increasing the air pollution that we're breathing in, right? So no wonder Black folks and brown folks have the highest rates of asthma in this country. Take Harlem, for instance. In Manhattan, 6 of the 7 bus depots in that city were located in Harlem in the Black community. Yep. So when we think about political determinants of health, we think about social determinants of health. Yes, research has shown us that the air pollution is coming from these social determinants, right? Highways, bus depots, parking lots even, that were built, and they decimated housing for many Black and brown individuals. But what we need to be asking ourselves is, how did those highways, those bus depots get there in the first place that caused the air pollution? So we've got to connect the dots, understand, the interplay between social and political determinants of health with environmental injustices, right? Because if we don't connect those dots, we're only going to merely nibble around the edges of the problem. So Kerene, thank you for that.
Yeah, and I want to make sure Jasmine Tasaki is in this conversation as well. Now, how do we then layer these issues that impact all Black people, but then we put in the lens of the experience of people in the trans community? How, in your work with WeCareTN, how are you talking about environmental issues or public health as it relates to the people that you serve?
I'm sorry, can you repeat the question again? I'm having some connection issues.
Yes, these Zooms, these Wi-Fis, we're all hanging, we're all struggling. But I wanted to ask Jasmine, in your work as director of WeCareTN, when we think about the broader impact of environmental issues and public health issues in our community, how does then the layer of the experience of the trans community get how does it is it worsened, or what are you seeing in your work with WeCareTN?
Well, unfortunately, it's not just in the work I do, it's in the life that I've lived for 37 years. Trans women are at the gut of every bad health disparity, financial disparity, and now as we talk about environmental issues, those as well. Support for trans women is far and few, especially in these instances of the social determinants of health. What we do at We Care Tennessee is address the social determinants of health. So we do HIV prevention from that lens where we address the social determinants of health. So instead of just doing testing or passing out condoms, we try to help address some of the financial disparities that these women go through. And sometimes it may just be something as simple as mental health, right? So we do a lot of programs that are based around mental health in order to ensure the women can make better decisions in everyday life. So I find that with our community, we have to really focus on the social determinants of health, and the political determinants of health, as I'm hearing, is just as important, but we're definitely at the bottom of that as well when it comes to decisions made from an upstream.
I appreciate that. And again, I'm going to go a little off script, but I wanted to really hone in on what we're experiencing every single day as it relates to COVID-19 and how that's impacting the Black community. And so, Dr. Dawes, if you could, a lot of people aren't able to really grasp why we're seeing such high rates of Black death and Black exposure to COVID-19. What, if any, role does our historical Black trauma play into why we're seeing these high rates of deaths in our communities?
Yeah, thank you for that as well. So I'm always surprised when I meet folks, you know, from the media and elsewhere who said, oh, are you surprised by the disproportionality experienced by the Black community when it comes to COVID? And I look at them and I say, absolutely not. These inequities didn't just suddenly appear. They've been with us for over 401 years in this country. We have long had the Black-white gap in health has always been with us from the very beginning of the founding of this nation until today. So it's not surprising. How did they originate? We know that through epigenetic research, that it has shown that there's intergenerational trauma, right? And this happens because inequality gets under our skin, right? The stress of racism wears our bodies down. And if you look at it from a scientific perspective, when you look at DNA, you look at the end of our DNA, telomeres. If you have a Black woman, for instance, who is 40, and a white woman who is 40, and they're looking at the telomeres, what they will see is advanced aging in the Black woman's DNA than they would a white person's DNA, right? It's a very interesting concept. And the idea is, if you think about it from this perspective, think about a block of cement and think about a drip of water that's just continuously coming down on that block. At first, you don't realize the impact that it's having on the block, wearing away at the cement. But over time, it does wear down our bodies. And so what we have looked at, and I look at from my research, is how has this connected then with the political drivers of these inequities? We know we talked about social determinants of health, these social conditions in which we're born, in which we live, in which we work and get educated and play, etc. But if it is true that these social determinants play an outsized role in our overall health, well, it's interesting to go back 401 years then in 1619 to see what the early colonies were doing to prevent Black and brown folks, Black people and Native Americans, the ability to grow their own food, to learn how to read English and write, preventing them from walking without passes at night, from congregating in certain numbers. I mean, the list goes on, right? All of these things that we now know as social determinants, there were policies that were devised to prevent them from addressing those social needs. So when you look and you tie that now to the research and you bring it on even into the 1800s, right? What we have seen is that there is a direct link between aggressive breast cancer prevalence in Black women. Black women have the most deadly form of breast cancer among all women, triple negative breast cancer. And that's been linked again to these policies from the Jim Crow era, right? So you come and bring that in. And yes, you know, our policymakers have wised up, because a lot of our laws now, they're not intentionally discriminatory on their face, but they have what we call in the law a facially neutral impact, right? So even though they may not say, yeah, Black people, we're going to discriminate against you intentionally, the effect of the way that they've crafted these policies is to exclude them from any positive benefits over time. And so, you know, there is this idea of the continuing tightening of a chokehold on these communities from these policies over time. And then I believe, you know, the reason why we're not seeing every population group being equally impacted by COVID is because our economic and social policies have not been benefiting all groups equally. So those are some of the reasons why I think we are seeing the disproportionate impact on communities of color, which again creates the comorbidities that you talked about, right? So these underlying conditions that have put Black and brown folks in this country at greater exposure and higher death rates as a result, because they have higher rates of obesity and diabetes and heart disease and lupus and HIV/AIDS, et cetera. So these are things that we need to think about and connect again to these determinants or drivers of inequities.
Thank you for that. And so Jasmine Hall, with you now finishing up your program at Harvard University and your master's in, in School of Public Health, I think you also could answer this question that I have. How important is data and research to how Black people are impacted by pollution, by disease? And are there any biases that exist within the collection of data that make your work even harder?
Well, I can answer that in so many ways, but yes, data is important to demonstrate that these issues are real, but it's also not perfect. And you have to listen to people. You have to not just look at, like, I'm an epidemiologist, but I value qualitative research because you won't get everything from the numbers. And then also who is asking the questions matters. Like, who's asking the questions? How are they asking those questions? How is the data even being analyzed? Like, these encourage more Black people to be scientists, because that will help. I do also want to jump back briefly because I wanted to jump in after Dr. Dawes.
Go ahead.
We were talking about some of the political determinants of health and how, upstream that actually is showing our disparate impacts of COVID-19, and it's almost like cyclical because then you have for example, evictions that are happening. And this is just, it's like, oh, upstream and then COVID, and then you still have worse things happening. Evictions, of course, this was already, a big issue in the queer community, but across the board now, you also have, and I think about with Flint, like right now we're trying to reduce the amount of secondary exposure to lead, but people are in their homes. And if your home is built, before 1978, you might be quarantining in a space where there's lead or asbestos or any other number of things that were already stacked against you. And then again, just thinking about lead, because I'm a lead prevention ambassador, but I think about the city of Flint. Just this past weekend, like, we had so much death this weekend, and the amount of violence that is, that's showing up as a result of lead exposure, as a result of disinvestment historically for so long, it's showing up now post-COVID. People are grieving, people are tired, people are essential workers. Like, it's just all, it's just all bad.
Yeah, and it can be overwhelming. And I think we appreciate having both you as an epidemiologist and Dr. Dawes at Morehouse School of Medicine, who have that lens for our community and the work that you do. And I think the research and the work that you do then empowers folks like myself and even Jasmine that are more on the nonprofit community organizing side to support our communities better. And so I wanted to make sure to ask Jasmine Tasaki just her views on how the medical institutions that serve Black people and folks that do this research work, how they can be better partners to the trans community.
I was so ready to comment on the other stuff, but I couldn't hear the question to me. You said, how does medical...
Yeah, how can we be a better ally to you in the trans community in terms of providing medical services and that research? How important it is to you, and then still, you know, dip in and answer those questions that you wanted to give feedback to.
Okay, so actually all of it is connected for me. When we talk about how important is data and research, it's very important as it is to any other community, but I think how data is disseminated and who does the research and those conversations and how they happen is what's more important, and that's where the gap is and the disconnect, right? We got to talk about medical mistrust as a community of Black people, which segues into my answer for your question, medical mistrust within the community of Black trans women.
Mm-hmm.
It's a thing that I feel it goes back to systemic racism and oppression, because every system that we have in place has disconnected us from land, has disconnected us from our bodies, right? So us not having a connection to those things, but then in turn being affected in those ways or in those areas, it just connects us back to trauma, right? We have a lot of trauma that has happened with land. We have a lot of trauma that has happened with medical doctors, medical studies. So for Black trans women, the best way to help be an ally to us, or to be the best ally, is to actually help us to see ourselves in ways where we can be scientists, where we can be doctors. Because the same way Black people need to see themselves represented, it needs to be a totality of Blackness. And we need to see every Black face and every Black movement represented for us to truly make change in any of the movements that we in.
Preach.
Yes, and if I could just add to that, I'm glad we're talking about data, because this is a fight that we're having currently with the Trump administration right now. As many of you have heard, you know, when it comes to COVID-related data, there's been an effort to bypass the CDC. I'm not praising the CDC. We've had those fights trying to get them to disaggregate data by race and ethnicity. But we were seeing improvements there, and then all of a sudden, with CDC wanting to do better, and start disaggregating this data and requiring that these laboratories and providers submit the data and break it down by race and ethnicity, collecting that data up front. But now the Trump administration has tried to bypass, to put it in a non-transparent platform and not make it accessible to all of us, right? Only a few people at HHS is able to get it. So it's really interesting, because in the history of this country, from the first time that we had an epidemic strike the US back in 1793, yellow fever, all the way until today, we have never been able to realize an equitable response during those times, because we did not get that data. We couldn't get it in real time. People have politicized data over the history of this country. And now there is an opportunity to get that data, and we see that same battle going on. So I just want to urge everyone to continue to pay attention to this piece and continue advocating for us to get that data and make sure that it's disaggregated so we can see what is going on. We can see a better picture. And I love the points that were made about looking at intersectionalities and making sure that those issues are included, not just race and ethnicity, but all these other demographic variables that are so key to achieving health equity.
Thank you for that. Now, I'm a policy wonk. I'm here in DC when I'm not stuck in my spare room talking to you guys on Zoom, you know, thinking about how to introduce and pass the policies and the bills that we need for our communities as it relates to our environment. And one of my really cool friends, Anthony Rogers Wright, he had a really interesting quote on the Green New Deal. I wanted to get your feedback on this. He says, how can a bill committed to environmental justice and climate justice not include reparations for Black folks, for slavery, for white supremacy that has fueled and concentrated oppression, as well as restitution to Indigenous folks for genocide, brutal land theft, and broken treaties? When we think about things that we need to do to make America whole, I almost said make America great, but make us whole and put us on a level playing field with equitable resources. How important is the talks about green reparations or just reparations in general for Black people?
I want to start off by saying I think that it's very important. But in any plan that we make for America to make America a better place, it needs to be a Black plan specifically. And Black people need to be at every level of that plan, because Black people have been the center of all of the plans that were made before, and it took away from our community. So reparations for Black people, specifically within land, is something that needs to happen. Will it happen? We don't know that. I don't know if that will happen, but I think that that needs to be at the forefront of any movement. Reparations for Black people. We helped build this country. We were in charge of the land, and with them bringing us into the fold, we were far removed from the land, right? Because they realized how much we were learning. So we couldn't learn all of that and know how to nurture the land at the same time. We had to be removed. So connecting Black people with land is ultimately the first step. And that's what needs to happen for us to have some justice when it comes to where we live, even when it comes to gentrification. That's a whole nother subject, but we need a Black plan.
Anyone else?
I'll just jump in, piggyback off of Jasmine. Like we absolutely need a Black plan, and we cannot we can't truly achieve any type of environmental justice goals without reparations because of what has happened. I'll keep it short and sweet. Like, yes, absolutely.
And I just say that I quite honestly don't understand the opposing argument when it comes to this issue. So I'm with Jasmine Tasaki and Jasmine Hall on this issue. Completely agree. We need a Black plan.
And I'll even go further. What roles, and this is for Dr. Dawes, as someone that is a part of the HBCU system, what roles have and do historically Black colleges and universities and those with medical institutions, what roles have they played in providing necessary services to our communities?
Well, you know, I'll give you the history of Morehouse School of Medicine. We were founded because in the state of Georgia, there was one medical doctor for every 200 whites and one medical doctor for every 13,000 Blacks. Many of our physicians tried to get into residency programs at Emory University or at Vanderbilt and were denied admission. Many folks who had studied pre-medicine, wanting to go on to medical school, were denied admission to these very institutions, these predominantly white institutions. And as a result, they were locked out of opportunities. They were on the downside of advantage and opportunity when it came to medical education, when it came to public health education, biomedical science education. So our institutions, from Howard to Meharry Medical College to Morehouse School of Medicine and Charles Drew, were founded to fill that gap and to diversify the healthcare workforce. It is a mission we take very seriously. I believe the numbers are that we produce at least 3/4 of the physicians, Black doctors here in the United States. So I cringe to think if we didn't have these 4 medical schools, where would we be in terms of being able to provide healthcare services to the Black community? And I will say, when you look back at the history in this country in terms of access to medical care, from the time that this country was founded, there was an effort by abolitionists and I'll just call them health equity champions to provide some level of healthcare services to enslaved Black people. But there was always this pushback, right? Not only to abolish slavery, but to provide them healthcare. Imagine that. And it wasn't until the Civil War when Abraham Lincoln and his supporters managed to eke out a bill by the skin of their teeth that would address, it was a health reform bill that would essentially provide healthcare services to newly free people, right? And again, even though there was that policy that was devised, there was always opposition to providing healthcare to Black people in this country. So they tried every single year. For 7 years, they finally succeeded in dismantling America's first ever health equity bill, or health equity program, I should say. And it would take us over 150 years before we were ever able to realize that with the passage of the Affordable Care Act under the Obama administration. So the movement to elevate racial health equity in this country has been led in many respects by Black physicians in this country, and who continue to push this agenda forward today. So Morehouse is proud to be a part of that cohort and push this this agenda. And we welcome collaborations in this space.
Yeah, as an HBCU alum, I would have been shot in the street if I hadn't brought up the opportunity to talk about the value of our institutions.
Thank you.
Yeah, I wanted to make sure we did that.
Appreciate it.
Now, so all of these conversations that we're having, all of these groups that we're representing, the intersectionality of not only the experience of the trans community, but then the Black community later on top of that. When we think about the environment and the environmental movement, just recently, not sure if you all saw it, but Sierra Club, which is our oldest environmental organization in the country, released a very in-depth statement about just their long view of having to deal with structural racism within the organization, and even how the founder of the Sierra Club had very racist views to Indigenous folks, to Black people, et cetera. And what we know to be the case is that a lot of our bigger greens, our predominantly white organizations, look at the environment and saving the planet in a very limited view, with the forest, with the polar bears, et cetera. But as we, as people of color, we of course are talking about social and political determinants of health, and where we work, live, play, and pray. So how do we bring more people of color on board to having really important conversations about the environment? Anyone?
Just like we're doing now, Black environmental justice organizations bringing people together, so that I know when I first learned about Black Millennials for Flint, I thought it was amazing. Like, I had never seen anything like it, and I'm glad someone was working on it, because I didn't know enough to get this started. I'm so grateful for Tracy, but there's so much of a disconnect, and to just see ourselves talking about these things and to connect it to the issues that we see, right in front of us, I think that'll help, and training more scientists and doctors and midwives and doulas.
Anyone else?
And to just,
What was the base question? I was in and out.
No worries. Zoom, right? Just how do we make these conversations we're having about the environment even more accessible to our communities, to feel like they're a part of it and that they matter, versus the traditional view of the environment that we've long held about the forest and things like that?
I think that people working.
Did we lose Jasmine? We might have lost Jasmine. Dr. Dawes, you got anything to add to this one?
Well, you hear my silence because I'm still, trying to figure this one out. I think, when I speak to a lot of leaders in the African American community, many say to me that, well, my God, we have a host of other issues that we're dealing with, right? And for them, there are issues that are more immediate in terms of the concern. So I think there's this mindset that, well, you know what, I'm dealing with more pressing issues right now, immediately impacting the community. And they haven't connected the environmental injustices as an immediate impact in some cases. How do we tie that? How do we connect that for them? I think that's important. That this too is an immediate concern. It's not a longer term issue that we can wait to tackle, right? So to Jasmine Hall's comments, I totally agree with her. I think this is a great start. It's these types of conversations that we need to have to elevate the issues and to build awareness. I think there are anchor institutions within our community that need to be a part of this conversation. They perhaps weren't involved in this work before. They may not feel comfortable discussing these issues. So I think it's important that with our anchor institutions, from the NAACP to the National Medical Association or the National Black Nurses Association and others, that they are brought into this conversation because they're trusted messengers in this. And I think they can help us to connect the dots better. So that's what I would add. But I would love to hear, what others have to say about how we do that and do it correctly.
Okay. Well, go ahead, Jasmine. Add in.
High paying green jobs, especially people in the door,
Yeah, I agree on the higher paying green jobs. I'm thankful that I get to work for an environmental justice organization that comparatively is better funded, but the vast majority of our organizations are struggling for resources. And we serve our communities in so many different ways. So I appreciate that distinction, Jasmine. So we're gonna flip over to the chat. The chat, I've been paying attention. It's pretty hot over here. And Latricia from Black Millennials for Flint says that there are 2 questions that she has. So I'll turn it over to Latricia and then we'll try to answer those.
Hi, everyone. Not to sound big brotherish, as you can't see my video, but I definitely want to make sure that the spotlight is on our phenomenal panelists this afternoon. So this question comes from Mackenzie Lilia, and I forgive me if I mispronounced your last name, but she says, thank you for hosting this panel. I'm a white female cisgender queer physical therapist. I was wondering if you all had any insights on how white cisgender healthcare professionals can assist in dismantling these healthcare disparities for people of color. That's an excellent question, Mackenzie, and I welcome either Jasmine Hall or Daniel to give a response.
I have one, and I'm sure you have a million. So I'll just jump in briefly. I keep going back to this, but I have so many friends. I'm 26, and I have so many friends who are, around the same age, who grew up in my community, also grew up extremely poor, and have gone to college or gone to trade schools. But specifically those who have gone on to the medical field as physician assistants or doctors, mentor them, make sure that they know that they can do it, make sure they don't quit, because having strong mentorship, just being checked in on matters. I'll stop there.
Well, I would add maybe something more general and just, encourage folks to engage in those tough conversations. I know it's uncomfortable. We have to have those tough conversations around race, place, and class. Continue them. Don't lose the momentum, and continue, to advocate for a full commitment to tackling health inequities upstream in all areas. I've heard from folks who have stated, and there are a lot of folks still in that leadership capacity that don't believe that they believe that this type of research is fluff. Right? I've heard those comments, and they haven't fully committed to it, even though we know, they make these statements and they push out these press releases saying, oh yeah, no, we're with Black Lives Matter. But some of the things the rumblings that I'm hearing still from folks is that there are many folks at that level that haven't fully engaged in those tough conversations. And I think that's important. I think we also need to research the history of the communities. You said you are a physical therapist, I thought I heard. And I think we need to research the histories of our communities and the communities of the patients that we work with, right? To address these inequities at all levels, to address the drivers that created and perpetuated and exacerbated these inequities. And so I think those are some of the things that I would actually urge folks to do, and to help to strengthen the networks and engagement level when it comes to these communities and these issues. I think that's going to be important.
All right, so I'll move to the next question that actually just came in. Trying to track it. What do you all think about the criminal justice system, specifically when it comes to situations like in Flint, Michigan, with Rick Snyder, who have perpetrated these crimes against humanity? There's an obvious disparity when it comes to these crimes committed against Black folks. How can we fix that? That's a powerful question, which kind of speaks to how do we hold people who are in these positions of power accountable for the detriments from environmental racism that impact our country. So thank you, Akut, and forgive me if I mispronounced your name, but that's an excellent question.
Well, I'd say we have plenty of opportunity in less than 100 days in terms of how we hold people accountable when we go to the ballot box. You know, on my TV in the other room is the funeral of John Lewis, who we all know to be just a mountain of a figure in terms of civil rights. But, you know, so many people put their lives on the line for our abilities to vote. So that's one way I think to hold accountable. But I'd like to lift up the issue for folks that are in prison and jails around just the contamination and the environmental impacts that a number of prisoners are experiencing. A lot of prisons are built on like Superfund sites or land that typically no one would want to build on because of past contamination. And so there's the high exposure to contaminants leading to a whole swath of health issues. People don't really think about people in jail like, oh, they deserve to be there, but these people definitely have the right to proper health care and those types of provisions, but we don't typically see them getting that. And even with the high rates of people that are incarcerated that are experiencing COVID-19 and the failures of those systems to really protect them. And again, it speaks to the purposeful disregard of our lives as Black people, and just knowing also that those criminal justice systems have gone after us even more in disproportionate ways on purpose to then use us for, you know, continuing slavery and the really minimized value of our labor. So many companies that we service all the time are using these very same people in jail right now to provide, you know, bottom to, you know, pennies to the dollar to labor. So it's all connected again to all of these things we've been talking about slavery and its impact and the trauma. And then now we're seeing the public health impact too to those people that are unfortunately still incarcerated.
I would like to say definitely we can hold people accountable through our voting and also where we spend our money and how we spend our money. But I think that another way of holding people in our community accountable is teaching our children. If we teach children at an early age about all the things that we're talking about as an adults, the accountability will be organic because the mindset will be different, and how people have these conversations, where and when they have the conversations, will change. I don't think that we can, once someone gets a certain amount of power in the systems that we are navigating through, it's kind of hard to hold people accountable in these systems. These systems have been designed where they cannot be held accountable. So we have to work from the inside out.
Yeah. I want to add.
Oh, go ahead, Jess.
So you were talking about just the ballot box. That's an important place to hold people accountable. And I feel like before we get to the ballot box, especially if people are incumbents, name and shame, you know, like make sure people know that they aren't doing what they're supposed to do. Mm-hmm. And then also, as we get privilege and power, make sure we don't become like the oppressor. And if we get into those positions, keep ourselves accountable to the people, to the community, and just be what we want to see.
And can I lift something else up? I want us to really talk about how powerful Black Twitter is. And we have to understand that what we have to call our own, that we give ourselves, is even more powerful than what white people give to us and deem to be power, right? So in our own spaces and in our own families and in our own communities, there is power with us standing together and just using our voice, right? That's one of the biggest ways to hold people accountable. Black Twitter and the council movement has been like instrumental in this last year of a lot of movements, right? So I think that our voices are yet still powerful enough to hold people accountable.
All right, I think that we have time to address, we have two more questions that came in, and I'm going to try to go in order. If for some reason your question isn't answered before we end, we'll send out an FAQ just to ensure that everyone's voice was heard today. So there was one that came through the chat. I'm going to try to find it. Okay, so we have from Demetrius. She says, or he or she says, I work with a white colleague who posed the question of how do we make privileged communities and white people care when it doesn't impact them daily? Ooh, that's a good one. Any panelists want to take it?
Well, I'll take that one first. I'll say that that truly has been one of the challenges that we've encountered at the Satcher Leadership Institute at Morehouse School of Medicine, trying to figure out how do we get communities that are more privileged to appreciate and understand and actually embrace policies then that will benefit the other side. So we've looked back in history and you know, talking about the Honorable John Lewis, he was an incredible champion on this issue. And I know he and I differed a little bit on this piece, being, you know, a complete pacifist. But I said to the congressman, what I have seen in terms of moving policies, more equity-focused policies, is that you have to have it align with a commercial interest and a government investment value. So what does that mean? What's in it for the government? Why should they give a damn? And the leaders who have been able to push for these health equity focused policies were able to show from a national security standpoint. For instance, in 1946 in World War II, when we saw at that period the number of young people who were unfit for military service, 20% of them were unfit during that time, right? And that was a national crisis for our admirals and generals and the Surgeon General. And that allowed folks to get the first ever mental health policy passed by the federal government, because they thought, oh my gosh, people are having post-traumatic stress disorder, they're dealing with all these issues. Now, before when they said, yeah, we can't deal with any issues of mental health, now all of a sudden when it's a national security issue, they could do it. So the way that we got the Affordable Care Act passed, and we got these folks who did not give a damn about Black and brown communities and the issues of racial inequities, was to say, look at where we are today. 70% of young people now are unfit for military service. You know, we have criminalized them from an early age. We see higher rates of obesity and diabetes and all these chronic diseases. So whether you give a damn about these communities or not, if we don't have folks who are prepared to serve in the military, how can we defend our nation from external threats? Right? That was one argument that resonated. So even though we had President Obama who said, yes, I want racial health equity as a key component of health reform, we had to make that government investment value argument. And then we had to figure out how to get the commercial interests to recognize that racism is very costly for your businesses, right? And so here's why you need to support this issue. So from a moral argument, it's never resonated in policy. When you talk about the structural racism, systemic racism. But when we talk about economic and national security and you tie it to those, we have seen some success, not complete success. And again, I think it's owing to the values that we have as a society still. We really need to change those values if we're going to move that needle of health equity forward.
I'm sorry. Go ahead, Jasmine. I apologize.
I'm sorry. I was going to say there's a lot of comments on Facebook that we missed, but what I will say is racism is costly to some, but it's lucrative to even more. A lot of people make money off of racism.
That's
a lot
true.
of people make money off of us being enslaved in these spaces that we are now, and they are banking on the fact that we don't see it as enslavement.
True.
So yes, you're right. Racism should be costly, and it is costly to some, but yeah, it makes money and it's lucrative.
Good point.
And I do want to, I know we're short on time, I do want to put forth this last question that came in, a powerful question. It says, thank you so much for putting on this panel. I'm a white trans man and I work in environmental justice and climate change advocacy in DC. Do you have thoughts on how to make sure that I'm advocating for the wants and needs of Black folks and dismantling environmental racism without claiming to speak for the community?
I would encourage, if you haven't, and to anyone on here, familiarize yourself with the Hermes principles and how to do democratic organizing. One of my favorite principles is making sure those communities speak for themselves. And if you're in a room and you're the only white person, it's saying, you know, who do we need to bring in to have these conversations? Because you're right, you don't want to speak for other people, but you do want to keep a lens for racial justice and equity in your work. So I think always challenging your hiring practices at your organization would be a good place to start. There's so many issues with retention of Black people and Latino people, people of color in the environmental space. So having those tough conversations internally about why you're the only white person in the room would be a good place to start, because there might be some uncomfortable conversations around systemic racism that exist where you are. So I think having those honest conversations and looking at making sure that if you do hire someone of color, they don't become your the face of everything that you do that's for people of color. That we don't want to be tokenized either. So having an understanding and a respect and empathy for any type of colleague that might be brought on too, I think would be helpful.
Said it.
All right, those are actually all the questions that we had. So I will defer to Kerene and the rest of the panelists with any closing words.
Well, I'm going to start with Jasmine Tasaki. Do you have any closing words or marching orders for us on this webinar?
I would just like to thank everybody again. And I would just like people to leave this session, this call, and to continue the conversation and to really be intentional about when you're having the conversation, not only stating the problem, but coming up with a solution and never doubting that your solution could be the actual solution. Pushing to get the vision that we have as Black people is something that we don't always do, but we have magical powers and we have so much in our brains that can help the world, not just our people. So we have to start trusting our vision and we have to pour into our own leadership and pour into each other's leadership. So take this conversation, let it not be the last, and let's make a difference.
Dr. Dawes?
You know, I will quote my mentor and the founder of our Satcher Health Leadership Institute, Dr. David Satcher, who often reminds us that what we need more than ever are leaders who care enough, they know enough, they have the courage to do enough, and they will persevere until the job is done. So I just wanted to leave you with those thoughts.
Jasmine Hall?
Thank you. I just want to leave us with listen to Black women, listen to Black trans women, and listen to Indigenous people. They will move us forward. Lead the way.
And I'll just say one thing before we call it a day. I think when we implement policies that address the needs of our most vulnerable, everyone is lifted up. And I think right now, as we are 100 days out, less than that, it's imperative that when we think about what to do for the future, that we make sure that we center the experience and the needs of Black people, of Latino people, of Indigenous people, to push us forward to really find the healing that we need for this trauma that we've experienced. So I want to thank Black Millennials for Flint and all of our great panelists for joining us today. All 55 of you who've stayed through the end of this conversation, for keeping that chat live. Please connect with us. Dr. Dawes has this great book that I put in my Amazon checkout thing that I'm going to check out, and make sure you check out the work that Jasmine Tasaki is doing for We Care Tennessee. And of course, support Jasmine Hall in Flint, Michigan. They're still, unfortunately, experiencing what shouldn't have happened in terms of their exposure to lead there. But it's hot in this room, and so I'm going to call it a day. Y'all have a great, great July. It's hotter than July, really. And peace be with you all. Thank you so much. Bye-bye.
Thank you. Bye-bye.